Greetings, this is your friend and brother, Doctor. If you are joining us for the first time, I welcome you. This is your YouTube channel where we do nothing but to educate you in the language that you will understand, devoid of medical jargons. What we do here is simply use the mistakes and the errors and acts of negligence from people to educate you. In clinic, in hospital, we see things every day bordering on ignorance and lack of knowledge. So it makes sense that we inform, those of us that have not made the mistake, so that we, learn from the mistake of others. That's simply wisdom. Okay. So this is the rejoinder video of what I said before about pentazocine injection. If you have not watched the video, please check the description button so you understand where the story is coming from, about a patient that was injecting herself with pentazocine because she was having pain on account of hemoglobin SS, and at a point she got addicted to it and couldn't stop it. And for the past 3 years, she has been doing that, and because of that, she has gotten a very big, wound that is putting her hand at risk. I've been able to secure her permission to show you the pictures, so that they say pictures speak, more than 1,000 words, so that we learn and avoid all forms of self-administration of injectables, particularly, in fact, all injectables, but in this case, particularly pentazocine and other, drugs that can cause addiction like tramadol, morphine. Okay. So that video was not complete, and I just talked about, the dangers of getting addicted to pentazocine. But here, I want to talk about, in case you are already entangled into the web of this addiction to pentazocine or any other, drugs that you are not dependent on. Okay, I want to bring the solution to it. Okay, if you are addicted to any drug, any substance at all, but in this case we are using pentazocine as a point of view. If you are addicted, what you need is what we call rehabilitation. You need to be rehabilitated, and there are two types of rehabilitation. We have the inpatient, that's the one you be admitted into the hospital, and outpatient, the one you be coming from home. If I'm to say, I would say that it is better you utilize the inpatient, because once anything has to do with addiction, you need to punish the flesh, for you to overcome it. There is no room for your comfort zone. You need to leave that your comfort zone and do all things possible for you to gain, because when something means addiction, it means that you are no longer in control of your will. One thing leads to another, and you are being propelled by an unknown force to go and do something that you don't like again. That is addiction. And some people have said it is spiritual, but then it is medically explainable. So it is how to do with your brain. All right. So you need rehabilitation, and I'm advising that you employ the inpatient rehabilitation. So what do you do? Depending on your location, what you need is to locate a nearby hospital, preferably a government-owned hospital near you, and seek for help. The Bible says those that seek help, will find help. If you don't know where to go, you can also, chat me up on WhatsApp. Use the number there. I will direct you to a nearby hospital near you. Okay. I'm not directing you to myself. Okay. To a nearby hospital near you, so that you get help. Very important. So that's basically what you need, rehabilitation. Okay. During that rehabilitation, it means that you'll be rehabilitated. So a lot of things are involved: psychological, medical, and otherwise. Okay, it is some people's jobs, and once you go to them, they will help you to overcome this rehabilitation. It's all about making you to come out from that, because you are entirely in another world. Imagine doing something that you dislike, doing something that ends in regret, doing something like that you don't want, but then you cannot still stop it. All right. So it is that. If you have any question regarding any form of substance abuse, or particularly in this case, pentazocine abuse, or sickle cell disease, or anything at all, or you have any suggestion to any topic you would want me to make a video on, please use the WhatsApp chat line and drop a message on WhatsApp. Thank you for listening. See you in my next video. Remember to please do us a favor by subscribing and sharing. I have informed you, but I have not informed your friends. You are the one that would be my anchor man to your friends. Thank you in anticipation for that favor. God bless you and Happy New Year in advance. Bye bye.